Hello there. This is Dr. Harold Pierre, board certified anesthesiologist and board certified addiction medicine specialist. I am based out of Tulsa, Oklahoma, with telemedicine services to Texas, Florida, and South Carolina. Let us begin. Just recently, I was looking at news specifically for addiction and came across this article. This is an article about the former NFL football player Aldon Smith, who showed up to the sheriff's department with a .40 blood alcohol level. Now, if that was me or you, we'd be dead, but not Aldon Smith. And it's because he suffered with alcoholism for several years, definitely throughout his NFL career. And it really led to the end of his NFL career. So, what went wrong? And I think a lot of it has to do with how we treat alcoholism. We tell the alcoholics, don't drink, and that fails. It fails probably 80% of the time, if not more. And we push this sobriety that most alcoholics can't achieve. Now, I know there are people out there who've gone to AA and 12 step and have succeeded. Great. You have a tool that worked for you. But most people doesn't work despite their efforts. So I'm going to give you an alternative that I found that worked 95% of the time. So first, let's establish one thing. Alcohol is by far the number one substance that is abused in America. The National Survey on Drug Use and Health demonstrated that 15.1% of the population reported having a substance use disorder, specifically with alcohol. Now, we've heard about the opioid overdose crisis, but when you look at the numbers over here, look at over here. Heroin, 0.6% of the population. And if you add prescription pain relievers, you're looking at 2.5% of the population versus alcohol at 15.1%. Now, I see one alcohol patient for every 40 opioid patients. And I find alcoholism a lot easier to treat. And that's because of this drug over here called naltrexone. Now, when you drink alcohol, your body will release endorphins. That's your natural opioid. That release of endorphins attaches to your opioid receptors in your brain and releases dopamine. Dopamine makes you feel great, so you drink more and you release more dopamine, so you feel even better. So that's really the biochemical basis for alcohol and specifically alcoholism. Well, what naltrexone does is it comes along, it blocks that opioid receptor, so the endorphins never attach, they never stimulate the receptor, they don't lead to any release of dopamine, and the alcoholics just decides to stop drinking. They're no longer interested. Now, when there is a significant drop in alcohol intake, you may end up with alcohol withdrawal. So, after prescribing naltrexone, the next drug I prescribe is diazepam, which is a benzodiazepine. The purpose of this is to really help specifically with one of the top incidences uh, or symptom of alcohol withdrawal. It's trouble sleeping is number one, and that can occur up to 18 months. And then the second thing is anxiety. And the worst thing is alcohol withdrawal syndrome. Now, I'll talk about alcohol withdrawal syndrome in another video, but suffice to say that diazepam is really the next drug, extremely important that every single patient I see gets some diazepam after they leave my office. The third drug is gabapentin. This is also known as Neurontin. This drug was FDA approved to treat epilepsy, but it's found uses both on and off label for many other things. Neuropathic pain, hot flashes, restless leg, also helps with opioid withdrawal, but it is receiving a much greater input in alcohol use disorder. Um, at higher doses, it reduces alcohol intake. But in my specific case, I am using this drug to reduce cravings. And cravings are pretty big after there is a drop in alcohol use. The next thing that people may experience is their blood pressures may go up. Anxiety also goes up, and all of these things can occur because of the withdrawal from alcohol. Clonidine is my fourth line treatment for alcohol withdrawal, and it will help with sleep. It will help reduce the potential high blood pressure that may occur with alcohol withdrawal. And it only costs $4 per month at Walmart. So it's a cheap treatment with lots of benefits. Now, the fifth drug, which you'll find surprising that I use, is actually alcohol. I never discourage my alcohol patients from drinking. Now, this is from the Sinclair Method, and Dr. Sinclair developed this method of using naltrexone and alcohol to help treat alcoholism. And the alcohol works by reducing the cravings. You have alcohol withdrawal, you stop doing something you've done daily or weekly for years, there will be a craving. Well, the best way to end that craving is let you drink. But because of naltrexone, you will lose interest in that drink. And I tell my patients, if you want to drink, drink. And when they come back, there's like a 90 to 95% drop in their drinking. Now, part of that is because I also give them bupropion. This is a medication called Wellbutrin, also known as Zyban. Many people may know it from smoking cessation. It helps with reducing the cravings for nicotine. But it treats two things here with alcohol withdrawal. It can treat the depression that may occur, and it helps with the cravings. So again, I have two drugs that help with alcohol. One that stops the drinking or reduces the drinking, that's naltrexone. The second that helps with the withdrawal. And the next four drugs, actually three of the four drugs, help with the cravings. Now, lastly, I will also use ketamine. And this is for a patient that is failing several of the other drugs. They're still depressed. They're still having anxiety. They're having a lot of alcohol withdrawal symptoms. And despite my 5-drug regimen, they're miserable. So as an anesthesiologist, in the past 15 years, I've probably given 25,000 patients ketamine. I love giving this drug because of all of the benefits it does with chronic pain and anxiety, but in particularly in alcoholism. The NMDA receptor is a receptor that alcohol blocks, And once there is an alcohol cessation, it becomes hyperactive, causing lots of anxiety, and we think potentially seizures. So ketamine is an NMDA antagonist. So when my patients are failing these other treatments, um, they're failing because they've significantly reduced their alcohol intake, it's time for some ketamine. So that's it. I didn't want to spend too long. For more information, you may contact my office, 918-518-1636, or you may come to my website where I try to put as much information here as possible. Plenty of videos. And as I mentioned before, there's a video here from one of my patients. It's a very inspiring video, and I hope you will
Hi,
check out the link and
everybody.
watch it.
It's Angel.
Thank you.